Namaste. I'm Dr. Anusha, Consultant Neurologist, Apollo Speciality Hospitals, OMR. On the occasion of World Stroke Day, I would like to talk a few points about stroke. As you all know, stroke is a very important neuromedical emergency. Stroke happens when there is a sudden blockage of blood supply to the brain. This can happen either two ways. One, by development of a clot inside the blood vessel in the brain, or by a rupture of blood vessel in the brain. So 85% of strokes, which we call as ischemic strokes, happen because of a clot formation in the blood vessel in the brain, and these are what usually brings the patient to the hospital. Another 15% is what we call as hemorrhage due to a rupture of blood vessel in the brain. There is a leakage of blood in the brain and the brain tissue, leading to features of stroke. Now coming to stroke, what are the symptoms of stroke? To remember it very easily, we use the acronym FAST. So FAST meaning F is for face. If you see any patient or any person talking to and suddenly has a drooping of one side of the face, then it could be a symptom of stroke. Another part of the acronym is A, F-A. A is arm. Any weakness of one arm while the patient, which happens in a stroke of a minute, is called as is one of the symptoms of stroke. And so basically, if there is any paralysis of any part of the body, be it the face or the hand or the leg, which comes acutely and suddenly, then we call it as a stroke. Then coming to the next part of the acronym S, speech. Any sudden speech difficulty, which may be in the form of sudden inability to understand what you are saying, or inability to talk, or a combination of both, or even a slurring of speech. Any change in quality of speech also indicates a possibility of a stroke. And last is T. Look at the type. Within 4.5 hours of onset of stroke, it is very important to bring a stroke patient to the hospital, because we have the potential to treat it with a clot busting agent. Now, nowadays we use another acronym which is expanded to include other symptoms of stroke which do not fall into the purview of FAST. So we call it B-FAST, B-E-F-A-S-T. Now B meaning balance problems. So some patients who have been walking around, they suddenly have an imbalance of gait. Anything which is happening suddenly, so we think of stroke. Other part of the acronym is E, eye problems. If there is any vision abnormality, a sudden loss of vision, or if there is a sudden squint, or any abnormality in the eye movements, we have to think of stroke. So to sum up, any balance problems, any eye problems, any facial drooping, any arm weakness, any speech difficulty could be indication of a stroke, and you need to take the patient immediately to the hospital. Now coming to the risk factors of stroke, we can actually think of looking at it in two ways. One is modifiable risk factors, another one is non-modifiable risk factors. So non-modifiable risk factors are age. So anybody above 60 years is more likely to have stroke than somebody who's 30 years. And the same way, it is shown that males have more propensity to develop stroke as compared to females, and some racial ethnicities may be protected against stroke. So these are non-modifiable factors which is not under our control. But there are a lot of modifiable risk factors like diabetes, high BP, high cholesterol, lack of physical activity, obesity, smoking, heavy alcohol intake, cardiac problems. So all these, and another condition called as obstructive sleep apnea, wherein there is sleep related breathing disorders at night, which is called as obstructive sleep apnea. So all these are modifiable risk factors of stroke. Now, when you have a patient in your vicinity who appears to be having symptoms of stroke, it's very important to bring the patient to the hospital. Especially the first 4.5 hours is considered as a golden hour of stroke, because in such patients, in those who have a clot formation in the brain, we can inject them with a special injection which is called clot busting agents or thrombolytic agents, which can go and dissolve the clot. So the maximum effect of this medication is when it is given within 4.5 hours of the onset of symptoms. So when you delay the presentation or bringing the patient to the hospital, you lose the golden opportunity to reverse stroke. But if you do end up coming late to the hospital, still stroke can be managed. But there is a lot of chances that brain damage has already happened, and more focus will be on preventing complications and as well as neuro rehabilitation. So, to sum up, if you want to prevent stroke, which is a devastating neurological disorder which can completely change your life in a stroke of a second or a minute, so you need to take care of your lifestyle and modify certain things, meaning you have to have a good diet with lots of fruits and vegetables. You have to stop smoking if you have the habit of smoking, and take alcohol moderately or mild intake, and as well as look into your risk factors. Do you have diabetes? Do you have high BP? If you have diabetes, try to get your diabetes under control. Eat the diabetic diet and reduce your sugar intake and refined carbohydrate intake. If you happen to have hypertension, take a check on your BP. Reduce your salt intake. Make sure that you're meeting your doctor and keeping your BP and your cholesterols under check. So by taking care, and if you happen to have any heart disease, continue your cardiac medications, and it would be advisable to get regular medical checks to see if you are developing any of these non-communicable diseases, which are invisible diseases. Unless you screen yourself for these diseases, you will not be able to identify whether you are already suffering from these diseases. So these are all some important tips which I would like to tell you on the event of the World Stroke Day. Thank you.